My name is Catherine Dabrowski. I am the Nutrition Outreach Education Project Coordinator and the SNAP Manager at Apache Community Health Center. At Apache, our mission is to improve the health of our community and to increase access to comprehensive primary care, preventive health services, mental health, and support services. We are committed to excellence and providing culturally competent services that enhance the quality of life. We advocate for and provide a welcoming environment for underserved and vulnerable people, especially Asians and Pacific Islanders, the LGBT community, and individuals living with and affected by HIV/AIDS. Apache really started the acronym for it before used to stand for Asian Pacific Islander Coalition Against HIV/AIDS. And over the years, it has evolved and contains medical services and non-medical services. So our medical services is regular primary care. If you need a doctor and if you need referrals or to a specialist, they will be able to provide you with that assistance. We do HIV services, so medication, testing, transgender services, PrEP and PEP. So that's the pre-exposure prophylaxis and the post-exposure prophylaxis. Those are medications you take if you think you may have been exposed to HIV. We have behavioral health services or mental health and HIV STD testing. I am in the non-medical services. So that means the SNAP enrollment, the Supplemental Nutrition Assistance Program. We do have medical insurance enrollment. So if you don't have insurance and are interested in getting assistance through a certified navigator, they will help you to enroll into Medicaid through New York State of Health. We also have Project Connect and other community activities such as a game, youth mentorship, a Healthier Me skills workshop, and community mobilization project. So Project Connect is for 18 to 24 years of age API youth, LGBTQ. So that's just kind of in a nutshell. We also have support services and case management and medical case management if needed. SNAP works for New York, the Nutrition Outreach Education Program. This program started about almost in August, it'll be 7 years at Apache. And the Nutrition Outreach Program, it's one of the other services we included because our view at Apache is what are the services a person would need in order to be self-sufficient and be able to take care of themselves. So we are here to provide support. If you are food insecure or if you're underemployed, if whatever things you need that we can assist you with so that you can, whether it's adhere to your medications or have a better quality of life, we are here to support that. Hippocrates said, let food be thy medicine. It's so important that every time you eat or drink, you are either feeding disease or fighting it. SNAP is the Supplemental Nutrition Assistance Program. What it does is it helps people already set aside a budget to buy groceries. SNAP increases that budget. It is very easy and convenient, so you end up getting more money to buy food. That's the supplemental part. I just want to emphasize that. And you can use the card at most grocery stores and farmers markets. And the way it works is that you get a benefit amount on the card, and whatever you don't use stays on the card. And the following month, you get the amount that HRA determines. And I'll explain about the estimates and how the benefits come up. And it kind of rolls over, so you never lose that money. The original minimum benefit was $16, but because of the pandemic, COVID-19, loss of jobs, it was increased to $19, so it was increased by 15%. And then the maximum benefit used to be $204 for a household of one, and now it's $234 for a household of one. Just to give the minimum information regarding that. Who can apply for SNAP? There are 3 requirements. It's based on household size, to be within the income guidelines, and to have a qualifying immigration status. So the immigration status, that would be a legal permanent resident status of at least 5 years or more in the States, a granted asylee refugee status, or people whose deportation status was withheld. Obviously, if you're a US citizen, you are eligible if you meet the other requirements. But this is for those who may not be US citizens or not US naturalized citizens. I'm going to explain the income guidelines. So it's, like I said, based on household size, income, and the federal poverty line, or the FPL. It depends on where you are, what's happening in your home situation. So 130 is, let's say, for those who do not fit into the 150%, which is those who are working, or the 200%, which is either folks who are disabled or have childcare or dependent care costs. So the monthly income for a household of one is, if you're not working and you're not 60 plus years of age or older, or have childcare or dependent care costs, you can earn up to $1,383 a month or less and still be eligible. Now, if you are working, that increases to $1,595. And for example, if you may be a mixed household, you say have a child, you may have someone on SSI or SSD or retirement and dependent care costs, then you move up to the 200%. And at this point, let's say if there's 3 people in the house, you can earn up to $3,620 or less and be eligible. The maximum benefits for a household of 3 is $616 a month. That would be if there's no income coming into this household. You would go, how many people are in the house, who's working, who's not working, if there are childcare costs or dependent care costs, and what is the benefit. I also wanted to share that everyone's income gets counted. So meaning once you're 18 years old, if you're working, your income would be counted if you're applying for families, because there's something called mandatory households, which would be parents, children, even if your child has a child, right? If you're 17 and under and you're working, whether you have a work permit, that income would not count towards the household.
You have to have like a familial relationship, or can it just be like, these are the people who are in my current household?
That's an excellent question. So for example, a lot of people are in a roommate situation. So for example, if you're roommates and you're not related by blood, you can have your own case.
Okay.
If your brothers, sisters, parents, you're all living together, sharing meals together, the key really is, are you sharing meals and are you related? Whether it's through marriage, or adoption, what have you, then you would be one household. At the age of 22, you can have your own case.
Okay.
Technically.
So older children, yeah.
Yes.
I mean, older, like if you have a child who's older and is,
yes.
Yeah.
But if they're living with you and you're sharing meals, then they may state, then you technically would be on the case with your parents. Okay. Because you're living there and you're sharing meals. Now, if you're able to state that, no, we're not sharing meals, even though I live there, then you can have your own case. Again, even if it's brothers or sisters rooming, living together, they can apply together if they want to, because they may get more money that way, or they can apply separately. Again, once you're 22, and if you're, let's say I'd be living with a brother or sister, and I am over 22, then I can apply with my sibling or by myself, even though we live together.
Okay, so
As long
there's a
as we're
little
not
bit.
sharing meals. Yeah, there is
Okay,
room.
okay, cool.
And
Thank you so
even
much.
if it's like, sure, even if it's distant family members, like an aunt or an uncle or a
Mhm.
grandparent, you can have your own case.
Great, excellent.
So NOEP, the Nutrition Outreach Education Project, NOEP coordinator is actually, my role is to check for eligibility, is to see if a person would be eligible for the program, how much they can get, and I provide you with an estimate. So I do the calculations for you and to assist with the entire application process. And I also do mediations and advocacy. And what that means is this is a partnership. So I work with the individual. I let you know what you need. I let you know of your estimate. I let you know of what I'm responsible for and what you're responsible for. So we can either do Zoom or by phone. It's the client's choice. And also if there is, if the person is comfortable with using a computer or has access to a computer, right? So I would do the application, fill everything out for you, and the person's role is really to submit the documents either directly to HRA, and whether that's these days, we're doing everything by the cell phone on the app. And if not, you can fax it over to my office and I upload it for you. So I do my part and the client does their part of like, these are the documents for everybody who's in the family. This is the income. This is the legal status. These are the expenses, rent, utilities, childcare, medical. Now, the only individuals who are eligible for medical expenses are those who are 60 plus or older or receiving SSI or SSD. Now, the whole portion of mediation, that is when I contact HRA and I ask them either why was this case denied, or it's been 30 days and the client has not gotten a response from HRA, whether they were approved or denied, or about the estimate of how come they got this estimate when I got another estimate. This is when I contact HRA through email, and if they need additional documents, I would go back to the client and ask them, hey, this is what HRA is asking me for. And then I will be able to provide that to them. And it can take up to a week, sometimes two, if not more, where they will review and let me know, yes, either we made a mistake and here's the money on the card, or here it's been approved for ongoing benefits or whatever it is. And this portion really is a benefit because it means the client does not have to go through fair hearing. Fair hearing is the last thing. Once a client comes to me and says, I've applied, this is what happened, I provided documents, can you tell me an estimate? Oh, by the way, I went to fair hearing. Once you went to fair hearing, that is completely out of my control and I cannot assist you within the mediation, but I can still provide you with a estimate. So this step is before fair hearing, which can take longer. And that's also includes waiting for a date and time and judge and all of that. So it's an additional benefit. And hopefully it's to not have to go back through, well, reapply for the application again, right? It's to see, make sure that the person doesn't fall through the cracks in a way. So students, there is also a campaign for students. Student is actually any person who's between 18 to 49 and they're physically and mentally fit and enrolled at least half time of higher education. And in this case, students enrolled at least half time at college cannot get SNAP unless they meet certain exceptions. One of them is they're working an average of 20 hours a week, participating in work study, which has no hourly minimum requirements, or 17 years old or younger, or primary caretaker of a household member who's under age 6 or incapacitated. Because of COVID, a lot of students and colleges let their students basically go back home, or they had work study, were not eligible. So what they did was, now there is, if you're part of even a trade school or employment opportunity center, you can get verification from your college that you are at college and you're trying to apply for SNAP. And they actually made it more flexible, where a student can enroll and be most likely approved for benefits. So that's just something for the college students. So like I had mentioned, the expansion of SNAP. So the OTDA is the Office of Temporary Disability Assistance. So anybody in the SUNY State University or a city university, whether it's technical education program or the Educational Opportunity Centers known as EOCs, can apply and be most likely approved for benefits. And work study, even if you were, let's say, eligible for work study, but were not getting work study hours because of COVID, you'd still be eligible for the benefits. Because prior to that, it was basically, unless you meet any of these rules, you're not eligible. Even if you'd be 1 hour short of meeting 20 hours a week of work, you would not be eligible. They would not approve of you. It was very strict rules prior to COVID. So these are usually the documents needed. It would be any state ID card. You can use your birth certificate or a US passport to provide proof of citizenship, Social Security. If you are working, it would be your statement. Now, again, if you are getting paid weekly, it would be 4 current pay stubs. If you are getting paid biweekly, it would be 2 current pay stubs. Or if you're getting a monthly payment such as SSI or SSD, it would be that award letter from Social Security Administration, as well as any utility bills that you're responsible for.
They take the New York City ID too, right?
Yes.
Okay.
Even if you have an ID from, let's say, another state, if you recently moved in,
Great.
then that's fine. In this case, if you don't have a passport, but you have a legal permanent resident card, you would use that.
Okay, got it.
And then they would just look at, are you resident since 2015? 2015 to 2021, that would be the 5-year rules.
Okay.
Now, for example, if you are a green card holder and you have a child under the age of 18 and they received a green card, right? They're actually eligible to apply because they're not 18 or older.
Mm-hmm. Got
So
it.
there's a lot of nuances as well within the program. So basically SNAP, it helps folks buy groceries and makes foods more available. For every dollar a person spends, $1 and change goes back into the local community. If anybody wants to get information or to see if they are eligible or get a free estimate, you can definitely call me directly. And for other services, we do have our agency's toll-free number if they're interested in whether it's testing, primary care, or we also have a pharmacy on site. Then you can definitely call us at the 1-866-274-2429 number to get more information.
If someone is trying to navigate the process and reaches out to you, is there a way of translating so that
That's
just to make the process easier?
Yes, that's an excellent question. Thank you. So English would be my main language now, but I'm also fluent in Polish, conversational Spanish. However, we do have a translation line. Call and make an appointment, and I can get whether it's Mandarin or Cantonese.
Great.
We do also in our clinic, we actually pride in having each person who works usually does speak more than one language. So we do have a variety of Japanese, Korean, Cantonese, and others. But if we cannot get a staff member who speaks the language, then I would most likely call the interpretation service line that we use at our agency. We are located at 400 Broadway on Canal Street, Walker and Broadway. So any train to Canal, and we are 1 block south of Canal. So if you're on the NRQ, it's just literally up the block. We're at Broadway and Walker, 400 Broadway. Just so that people do feel safe, we're doing telehealth, video conferencing, but also in person for those who do need to come in person. Every chair in the waiting area has been divided. There's plexiglass everywhere. Everyone wears a mask. Temperature checks are taken as well. And we are definitely limiting the amount of people allowed in. So there is social distancing. And a lot of people are vaccinated, but the COVID restrictions are not removed from the community health center. They're still in place. So it's
That
for
makes
everyone to
a
feel
lot of
comfortable.
sense. Yes,
Mhm.
great.
For all of our services, I would say it's best to call for an appointment, just because we are in a rotational system at our agency. So depending on the function of the job and who the person is, right? They may be in the office more often or every other week. So it would be best just to schedule. And the same thing would be for medical appointments. First and foremost, yes, these services are free. You do not have to pay someone to help you apply for SNAP. That's
Please
a
don't do
scam.
that. Yeah.
Please don't do that. Yes. When I told my funders that a lot of people were paying to get help, they were appalled by that. So this is free. If anyone asks you to pay for help with enrolling into health insurance or SNAP or anything like that, turn the other way. There are
Hang up the
community-based
phone, yeah.
organizations that will help you, and it's for free. There's nothing worse, I think, than you may be limited on income, or you were either laid off because of COVID or what have you, and you should not have to decide between, am I going to pay rent today, this month? Am I going to get my medicine, or am I going to buy food, or am I going to go hungry so my child can eat? No. This is to help you for free. This is free if you do not. The best payment is, if you are happy with the service and if it has made an impact in a positive way for you or your family, please share that information with the people, with your neighbors, with your friends, who may also benefit. If you have certain or further immigration questions, contact either of you do have an immigration lawyer. If you don't, but you want to get more information, then I can always provide that referral to New York City Coalition for Immigration Legal Aid Society, or even Cabrini Immigrant Services, who also do provide consultations. But a person would not have to be afraid, let's say, to apply if they want to apply on behalf of their children. Obviously, the child would not be, it's the parent who would be the head case who's applying, but the benefits would only come for the children, and they were to be used for the child.
If someone already is enrolled in SNAP, but is having perhaps issues with getting benefits on time, or their household size or something like that, can they reach out to you as well, even if they're already enrollees?
Yeah, so not only do I help folks enroll and apply for the first time, but I do help those who are current SNAP recipients. If you need to renew your case or recertify in this case, if you need to notify HRA of changes, or just do can I get an estimate of how much am I actually, this is what I'm getting, how much am I eligible for? Or change forms, periodic reports, which is periodic reports are the 6 months check-in, like, has anything changed? Has your income increased or decreased? Have your expenses increased or decreased? I can assist with all of that.
Wonderful.
I do want people to get the services that they need, and I'm here to help.